maybe you could give us a bit of an outline of what a DMT experience might be like.
Yeah, sure. Well, I guess I should describe, the setting in which volunteers received DMT. It was a hospital room, pretty stark, on a clinical research unit, which also was, doing a lot of experimental cancer chemotherapy research. So it was a, pretty, serious place. Um, Volunteers were normal volunteers. We screened them for any, for any psychological or any medical problems. They were all experienced with, psychedelics. Only a small number of them had used DMT before. This was the late 80s, early 90s. And it was still a pretty unknown drug. Um, that was, changing with, Terence McKenna's work, but still it was, relatively obscure compared to now. Um, and as I was, saying early on, it was just a clinical psychopharmacology study. And we told volunteers, not that much. I described it as, fast onset, short duration, fast offset. And you may, feel as if you've left your body, and as a result you might be afraid that you've died, but don't worry. Nobody's died, and we have a code team on call at all times. So that kind of was the bare bones preparation. I mean, it wasn't like, well, there's this thing called a mystical experience that dates back to the Vedas, and it's like, okay, this is, DMT. It's very strange. It's very fast. Don't be afraid. Be calm. Before I inject the drug, and just keep your wits about you, and observe and just do your thing in there, and then come back and describe it to us. So that's that was the set and setting. Most of the volunteers in the first set of studies were friends. So they knew me, I knew them, we trusted each other. And they had been standing in line for 2 years to participate in the study. So during that time, we kind of worked out an agreement, like, you'll be going into this state, and it's important to remember as much as you can, and we'll talk about it afterwards. So they had, 2 IVs in place, one in each arm, rectal, thermistor, like a skinny wire, to, measure temperature, and a blood pressure cuff. So they couldn't really move. They were strapped in. And at first, when I would describe the setting to them, when they would, come in, to my office, and we'd start talking about the study, like a month or two in advance. I would, describe the environment in the hospital, and at first they would be kind of leery. It was a fraught description, but after they thought about it, and especially at the time of the study itself, they were glad that they couldn't move, because it helped them just, give up resistance. They just were going to surrender to the drug effect. They weren't going to fight it. They weren't going to move around. They weren't going to, try and get up and start dancing or something. They were going in deep. I would, walk upstairs, from the, pharmacy in the basement with a, little, syringe of, frozen DMT in my shirt pocket, and would be, thawing out as I'd be running up the stairs. There was, me on one side, and, the nurse on the other side of the bed. They'd be, laying flat, with eye shades, because early on it was just, too distracting if you weren't wearing eye shades, because of the room breaking up visually, and, the rush. You really wanted to, have your wits about you as the effects began. And if you're, looking around disoriented, by the onset of the visions, it's, difficult to focus. So, I would ask them, to take a breath, to relax, to tell me when they're ready, tell me when you're ready. So people would, close their eyes and, take some breaths and calm themselves. And they say, okay, I'm ready. I'd, stick the, syringe, through the diaphragm. And I would, begin infusing it over the space of, 30 seconds. I would say I've started now, halfway through. Okay, I'm done. Pulling out, the drug syringe. Okay, I'm injecting, saline now, to clear the line. Yeah, and over the next, 15 seconds. So we gave a number of different doses: placebo, small, a couple of medium, and one large. So I'm describing the large effects, the large dose effects. You would start to, feel the rush at about after just a couple of heartbeats. There would be an inner sensation of anxiety and acceleration, pressure, inner pressure. It was very important to stay, calm, during that 15, 30-second rush, because it was quite powerful. With eyes closed, there would be the appearance of, rapidly, moving, morphing, kaleidoscopic, heavily pixelated, visual imagery. Frequently, not always, but, fairly often there was a buildup of a high-pitched sound. So the rush and the sound would, kind of, climax at about 30 seconds, 60 seconds, and you would be catapulted or find yourself or propelled into this world of light, space full of light, black space, full of light, and it was quiet. It started off with that high pitched crescendoing sound, but once you were there, it was utterly silent. You couldn't hear anything. Well, you were functionally deaf. There'd be stuff going outside in the hall, and volunteers would just be lying there completely oblivious. The first couple of blood pressure checks with that automated cuff, which exerts quite the grip. People were completely unaware of the 2-minute reading and usually unaware of the 5-minute reading. So they were moribund, at least to the eye. So these visual images could coalesce into definable discernible figures, insects, reptiles, plants, statuettes, robotic things, birds, any number of discrete objects, and we ended up calling those things the beings. But even if there weren't beings, there was still this sense of intelligence and of power in that state, even if it may not be localized to a specific thing that you could see. So there would be interactions between the beings and you, between the state and you. The feelings were full. Whether to call them blissful or ecstatic, it would be a little difficult to characterize them. It was more of fullness. The peak effect like that, where you're hanging out in that space at maximal intensity, might be about 5 minutes, 7 minutes at the most, maybe 10 minutes. But still, it's a pretty busy time, and most volunteers were amazed it was only 10 minutes. They would, they felt it was half hour, 3 hours, and a much longer period of time, than actually elapsed. So they'd start coming down around 20 minutes after the injection. They'd be able to start, moving around, flexing their hands, extending their fingers, feeling themselves kind of return back into their bodies. Yeah, and at the half-hour point, almost everybody, was straight, was sober, talking. Within another 10 minutes or so, they'd be drinking tea, filling out rating scales. The time course corresponded, to the levels of DMT in blood, which were peak at 2 minutes and at 5 minutes, and then began to precipitously drop after that, and were basically non-detectable at the 30-minute point. People would start feeling functional again, and start describing their experiences. We'd spend another half hour, maybe an hour, talking about what happened, and I would be taking notes and transcribe them later.